you're sensitive to that food. Make your body such that it does not support bacteria. Okay, you guys probably know what happens with the leaky gut. So this is how the leaky gut will slowly progress and develop a leaky brain. And then what happens to the leaky brain right here, the cross-reactive antibodies and inflammatory cytokines. Then you have neural cell antigens are released into the blood, which attack the nerve cells, and you end up with neuroimmune disorders. Okay. Dr. Aristo Vojdani is absolutely amazing with gut health, so if anyone wants to read up. Okay. When I'm testing a chronic Lyme patient and chronic mold patient, for gluten sensitivity, these are all the antibodies I look at, not just one or two, not just transglutaminase, etc., but all of these. Especially in patients that have already been diagnosed with MS or lupus or Parkinson's or cancer, we look at what's going on with the food. Okay. Sometimes the body is confused and there is cross-reactivity. So all of these foods, and that includes chocolate and coffee, the body mistakenly thinks it's gluten, and you still get the gluten reaction. Especially for children, it's very important. The best way to do is to do an elimination diet and see. There are, of course, lab tests available. I don't think they are available here. Another simple diagram. So as you can see, bacterial proteins can permeate your intestinal barrier to cause leaky gut. Right, this is your immune reaction right here. Right, so the reaction to gluten and gluten-like antigens goes through the toll-like receptors. It can give you heart antibodies, kidney antibodies, adrenal, can attack the ovary, prostate, and brain. These are the organs that have been studied so far. Right? And then ultimately, you could end up with a multi-organ system disorder. I mean, regular gluten that is available in the United States is really, really bad. It's very bad for people who are chronically ill. It just kills you faster. Okay, so this is how you get the hypersensitivity reactions. You get your skin reactions. As you can see, interleukin-4, IL-15, IL-13, they're all involved. And you can see histamine, serotonin, prostaglandins, tryptases, and chimases, they're all affected. Of course, the physicians will understand this better. Most of the children that come in, they're like, ew, Dr. Dashore, I can't talk about my poop, but I need to know. I need to know all of this information. It is part of the diagnosis process. Just like the tongue diagnosis, pupil, pulse diagnosis, I do a gut diagnosis or a poop diagnosis. So we need to know all of this information. Okay, now here comes, let's see, let's take a vote. How many of you have pets? A lot of you, okay. Wow, okay. Yeah. This is good. Less neurotic. More neurotic. More agreeable, really, huh? Okay. All right, now getting serious. Okay, none of the zoonotic parasitic infections acquired from dogs and cats are reportable diseases. So no systematically collected data is available, but they are very easily transmitted. Whoever is, if you have a dog that is licking your face, breathing in your face, they are going to be okay, but we are not, only when we have a suppressed immune system. So just take good precautions with your pets. So good personal hygiene. I used to use, my poor puppy. Every time she came back from a walk, I would be like, I would use baby wipes on her, toilet wipes. I would wipe the paws and nose and oh my God, everything, because my son was severe at that time. But we just had to be very careful. She would look at me like, "You crazy, mommy?" It's like, "What are you doing to me?" And then after a few weeks, she would just bring her paws. "All right, fine, clean them." And then she would ask for bacon, but that was fine. We'd give her bacon. Okay. Use a preventative treatment year-round. Feed your pets cooked or prepared food, not raw meat. Right? Minimize exposure to high-traffic pet areas, meaning, if you're using dog parks and whatnot, just take extra precautions, especially those of you who are not taking off your shoes when you enter your house. So just think about what you're dragging in. Okay. I think that the rest is, the last one is important. Every one of you pet owners needs to be dewormed. You, human beings, need to be dewormed twice a year. Those of you with issues, those of you with no issues, you can be dewormed once a year. Just make sure you're doing a good parasitic cleanse once a year. You will add years to your life. And if you deworm your pets herbally, you will add years to their life. Okay, how do you treat? Antibiotics, homeopathy, herbs, iodine, vitamin A, sure, all of that. Right? Just remember to start low and slow and make sure you treat them all. Even if you see IgG. When you have a compromised, in a way, who makes the IgM antibodies in the body? Physicians. What system in the body makes the IgMs? Well, that we see in the labs. For that matter, yeah, IgMs. Let's go with IgMs first. It's your immune system, right? Your immune system makes the IgMs. That is your first response. When you have infections whose job is to suppress the immune system, is it possible to see IgMs a whole lot? If you would be very lucky if you see IgM positive. Most of my patients end up with very high IgG positives. That's a delayed reaction. Immune system has some time, to produce that. Less is required of the immune system to produce the IgGs. So if you see IgG high viruses, please treat them. Okay, please do herbal protocols because most doctors will not treat, even if you see IgG high bacterial infections, like mycoplasma, chlamydia, you'll see a lot of IgG highs. Please always treat them. There are herbal protocols available. This is what I do. Okay, you start with neurological and endocrine support, right? Because we need to reset the body's cellular communication. We want the cells to start talking to each other again, and the body's stress response to become normal. Then second step is digestive support. We need to add support for the major detox organs, and we need to add nutrients to the body. Step three, is filtration and drainage support. We open up the liver, kidney, lymph, lungs, and skin to open up the detox mechanisms. Number 4, as you will see right here, that is when, after doing all this, is when I start to eliminate the causative factors. That's when you start antimicrobials. So this is, cleaning out the extracellular matrix. Then you look at intracellular, what's going on. So after you've done all the killing, then remember you have to repair the damage. So Lyme disease causes actual damage to your connective tissue. Doing antibiotics, even if it is acute Lyme, may stop your symptoms. That doesn't mean the damage has been repaired. That is where remission occurs. Not too many people think about this. They think, we've killed the infection. Yes, but have you given your body the tools to repair the damage that was done by this very powerful bacteria? So repair is important. And finally, I have patients that get to healthy maintenance. Example of maintenance protocol is myself. I am on a maintenance protocol right now. I'm doing about 11 herbs and 5 supplements every day. This is a little bit about homotoxicology, how it works. So as you can see, it combines the best in homeopathy and allopathic medicine. So this gives you a very strong complex homeopathy remedy called homotoxicology. Correct. So one of the things that I learned was, these are the early phases. So if you start helping the patient, most patients are either in phase 2, the reaction phase, where you see little fever, GI upset, inflammation, or they are in phase 3, right? You have the connective tissue issues. The toxins are in your fat tissues and vascular system. Once the biological division is done, once they go intracellular, that is tough. And as you see, stage 6 is where you enter into the cancer phase. So the body has to go through all of these phases before you ever get any cancer. The body gives you a chance over and over and over again with clues that please help me. And you keep treating your symptoms without looking at the underlying cause, and then people end up with cancer. Of course, genetics play an important role, but that was just a rough idea. Okay, I think you have these in your handouts. Okay, so Stephen Buhner. How many of you have heard of Stephen Buhner? Yeah. Okay. So brief introduction then. Stephen Harold Buhner is world's #1 herbalist. He's extremely renowned, 21 books. I'm very, very fortunate to call him a friend and a mentor and my teacher. And he is an earth poet. He's very reclusive. He's amazing. I just spent about a week up in the mountains of New Mexico with him and his family. It was absolutely amazing. You learn so much, other than fresh marijuana. I didn't say that. Okay, so we have wonderful herbal combinations that we have been given by Stephen, and they work. Now keep in mind, anybody's protocols on the internet, don't follow them blindly. Always get a practitioner that understands. If you don't have a practitioner, then yes, try to do your best what you need to do to heal yourself. But don't follow any protocols blindly. They could be too strong for you. They may or may not be appropriate for you. So self-diagnosis is great. Self-treatment is great if there is no other options. But if you do know a good local practitioner, a friend who knows a little bit of natural medicine, always bounce ideas off each other. Okay. We will discuss the handouts. You have Buhner's protocols in there. The Epstein-Barr, sorry, what?